October is Breast Cancer Awareness Month, and today we are bringing you a very important conversation. Breast cancer affects 1 in 8 women during her lifetime, and that number is way more than just a statistic. We are joined by Dr. Sarah Couch to help us separate fact from myth, highlight the latest in early detection treatment, and talk about how every person should know about their breast health. Thank you so much for coming on set today.
Yeah, thanks so much for having me.
Of course, we are seeing the pink all over the place, all of these events to bring awareness to breast cancer, but this is a serious issue that so many women and men face too. So what is the best way to diagnose breast cancer so early on?
You know, we've made some changes in the recommendations recently, and I think that getting people's knowledge about the options available to them is really helpful. First and foremost, women know their bodies the best, and men know their bodies the best. If there's a change on their home exam, we recommend just checking everything out once a month or so. If there's any new discharge or skin changes or a mass, alerting their doctors, either their GYN or their primary doctor, to get that investigated is really helpful. And then in addition, once you turn 40, you know, it's a time when a lot more checkups start happening.
Right.
But an annual mammogram is really still the best tool. Now, there's some people who might have a different risk because either their family history or a previous biopsy pathology. And for those patients, maybe getting an extra screening test with a MRI could be a really helpful addition. And that's more on a case-by-case basis, but we can help discern who that's going to benefit as well. But starting simply every year at 40 with a mammogram is super helpful.
And you mentioned that you should start at 40, but if there is a family history of breast cancer, should you start that earlier?
It really depends on that calculation, or if there's some specific genetic conditions that are running in a family. That's best kind of decided on a case-by-case basis, but by and large, 40 is a really good number to remember for the majority of patients that you see out there.
Okay, you kind of talked about some advancements in treatment. I know Baptist Health, you're making strides in that. So what are some of those new things out there?
So the best thing is that more and more research that we do helps us pinpoint and be more precise with the exact level of treatment that each patient's going to need. And a lot of it depends on each person's specific type of cancer. So we have some additional testing that we can do on types of breast cancer just to decide if it's even going to be helpful for a patient to get chemotherapy. I know that's a big concern when I meet patients up front. You know, because I have this breast cancer, does that mean my hair is going to fall out because I'm going to have to get chemotherapy? And that's just not the case for every patient. And so really being targeted on each person's specific pathology, extent of disease, we can be more precise, which I think gives patients the best outcome.
Absolutely. And would you say that's really Baptist Health's approach to cancer, is really making it individualized?
Yes, I think that we have a very dedicated team of physicians on the surgery side of things. I'm a part of a team of 2 other surgeons who really focus, by and large, a huge percentage of their practice on breast cancer alone. And then also with the medical oncology side of thing, and then our radiation oncologist. And we work very closely together. We're updating each other back and forth about mutual patients so that we can stay up to date with how they're doing and kind of what the next step should be. And then also participation in a tumor board where you can discuss each patient when it's a trickier situation to help guide that specific pathology patient through the best course. And so it's not a mystery where each stop they're getting different information. We really have a very cohesive message. And that gives a lot of confidence in the treatment plan, and then also just takes away the question. And I think that that anxiety of not knowing what to expect, both on surgery or chemo or radiation, being able to tell patients a consistent message is really helpful.
Absolutely, and kind of easing that, like we are all in this together. We're trying to find a cure, trying to find the best treatment options. So when that patient initially comes in, what are some of those myths or maybe misconceptions that are constantly brought up in those conversations?
Sure, I hear a fair amount, especially about screening. There'll be some gaps between when a patient had a mammogram and then when they had their next mammogram. And some people have heard that just getting a mammogram can cause cancer, or if there's one that's there, it'll cause it to spread. And really and truly, that's not the case. Breast cancer is a problem that mammograms have helped us identify cancers before there's even a palpable change or problem. And that usually means that it's a lower stage problem. And early stage breast cancer has the best survival because we have the most tools, the most tricks up our sleeves, if you will, to be able to target that cancer specifically, give that patient the best amount of resources and options. And so mammograms don't cause a breast cancer. They help us find it really and truly at the earliest stage that we can. And then the same thing about biopsies. I have a fair amount of patients who have a lot of anxiety about getting that tissue sampled because they're afraid that by getting it sampled and having some tissue removed that it'll cause that cancer to spread. And really, we don't know the right treatment for something until we can see it.
Right.
And so the pathologists work hard to give us that answer quickly so that we can move forward with treating it as soon as we can. But screening and biopsies help us determine the plan.
Yes, and early detection is certainly key because that's how you are truly saving lives. So thank you so much for taking time out of your very busy schedule. This is a really great conversation, so I really appreciate it.
Absolutely. I'm happy to always talk about and give people more information to make the best decisions for them.
Well, thank you so much. So again, if you're interested in learning more, just go over to baptisthealth.com.